you wondering how it is a chiropractor figures out the source of your low back pain? My name is Dr. Robin Armstrong. I'm a chiropractor at Willowbrook Chiropractic, and today I'm going to work with a model patient to show you an exam that helps me figure out the source of your back pain. Now, you may have seen our first video, Low Back Pain Detective, where we're asking for you to bring in as much information as possible so that we can help you figure out what's going on. And so that's what the history is for. So I'll have asked a lot of questions, you'll have brought in a lot of information for me, telling me when you feel pain and when you don't. So I'll have a good idea going into the exam of where I want to focus. So this patient says that they first had their low back pain when they lifted their son up onto a play structure. They're not complaining of any pain into the leg, they're not complaining of any numbness or tingling or any weakness in the foot. So that's good. So it doesn't sound like there's a nerve involved, but we want to look a little bit closer. I might ask them to walk on their heels and walk on their toes, which tests some specific nerves to those muscles to tell me if that nerve's involved. Then I might look at their posture. Sometimes when the body is in a lot of pain and spasms, we might get pulled off to the one side. There might be an imbalance in the hips based on your posture or the activities you get up to during your daily life. I'll ask them to bend forward. This seems relatively pain-free. And bending backward. Okay, that seems to cause some pain when we go backwards, so that tells me maybe the joints of the back are involved. Then we can narrow it down a little bit, twisting and leaning back. Seems like the left side is painful. Not so bad to the right. So now we're thinking left side low back pain possibly coming from the joints. Next, I'll have them lie down on their backs and I'll move the legs around to see how that impacts their back pain. So with the patient lying down, I'm going to do a few tests where I maneuver the legs to see how that impacts the low back. I might also want to test the reflexes. So there's a knee jerk reflex and an ankle jerk reflex, and we want to make sure that those are normal to determine that the nerves aren't being affected. I might perform a straight leg raise. So this is a nerve tension test, and often with someone who has nerve pain, we'd only get about halfway up and it would cause pain. But it seems like I can go a little bit further, just a little bit of tension in the muscles, but no back pain. This is good. I'm particularly interested in the left side because that's the side that they said they had the back pain on. And that's moving pretty well. We can check the hip motion to make sure that it's not actually a hip problem presenting as back pain. But it also tells me if there's any muscle tension. On this patient, we have a bit of hip hiking, meaning that there's some tension in the front of the hip muscles. So we're going to want to think about how that impacts their back pain and make sure we address that in treatment. Next, with the patient lying face down, I might do a little bit more hip testing, seeing how the hip moves in this position, and seeing also how it impacts the low back. A little bit of pain when I lift the leg up there. And then I'm going to feel the muscles as well as the joints of the spine. So we're going to feel the hip muscles, see if there's any tenderness or tension, the muscles of the low back, and I'm feeling quite a bit of tension, so a hardening of the muscles there, showing me that there's a bit of a spasm, a little bit more on the left. And then I'm going to poke around a little bit, moving the spine from side to side to make sure there's good movement there. And as I get lower here, seems like there's a bit of a jump response, a little bit tender and painful, again on the left. So this wasn't a complete demonstration of all the tests I might do, but from this exam, it shows me that this patient had pain in their low back on the left, most likely a sprain or strain of the joints, as well as a muscle spasm there. So I'll explain this to the patient and we'll come up with a plan to solve their problems, get them out of pain, and get them back to enjoying their life and being able to lift their son pain-free up onto that play structure. We post regular content under Willowbrook Chiropractic on YouTube, Instagram, and Facebook. If you have any questions about what I've talked about here today, please feel free to ask myself, Dr. Robin Armstrong, or Dr. Jody Friedman. We're always happy to help.